Very important thing that comes up when we're talking to patients about surgery is pain. Pain control is very important, and by no means do any surgeons want their patients to be in pain after surgery. Unfortunately, most surgery involves some level of pain. In order to control that pain, we often have to use medicines that can have some very harmful side effects. And there's a significant trend nowadays to try and limit the amount of narcotic or opioid pain medicines that are being used. So what are opioids or narcotics? These are special medicines that block the opioid pain sensors in our body, and they're very effective in pain control. Unfortunately, what they do is cause a lot of other side effects, and the most important problem they cause is addiction. And prescription use of narcotics that is subsequently abused has become one of the leading causes of addiction in America. So this has become an epidemic or a crisis in our country where people are abusing opioids and narcotics, and it's causing significant problems in our society, and in many ways even more so than illicit opioids such as heroin, which is the most common illicit drug of opioid. So we have then been tasked at many levels to reduce the amount of narcotic prescriptions that we're using. And so narcotics and opioids are just words for the same thing. There are a lot of enhanced recovery protocols in surgery nowadays, and what that means is that we are trying to make the process of patients recovering from surgery more efficient. One of the other side effects of opioids or narcotics is causing constipation, and those receptors that also affect pain, there's different receptors that actually make the intestinal tract slow down. So it's very common when we have patients on narcotic medicines that they end up with constipation. And some patients overlook the fact that when they're prescribed a narcotic, they really need to be drinking more water and being on a stool softener. I have a lot of patients who come to me who have developed hemorrhoids, fissures, or other anal pain problems because they've been on narcotics. And so just taking a few doses of narcotics can set you on a course that immediately will cause things like constipation. Another thing that it causes is ileus, which means a delay of return of your bowel function after surgery. In addition to a lot of people, even after just a few doses, becoming addicted and then really struggling to get those patients off of narcotics, and then leading to things that are really terrible in their lives, such as loss of jobs, loss of loved ones, loss of money, and then ultimately loss of life. People do overdose on prescription medicines that they've been given, and so we're seeing people die from this. So when you're having surgery or going to have surgery, I think there needs to be an understanding, and a lot of people agree to this, that you're not going to be pain-free after surgery. You're going to have hopefully well-controlled pain, and if there are options to have your surgery done with smaller incisions, that can help, but there's still pain there. And so patients really need to understand that their doctors are looking out for them when we're not giving you a high level of pain medicines. And so we've taken to adding in a lot of non-narcotic medicines, such as anti-inflammatories like ibuprofen or Celebrex, which you have to be cautious with because you need to take them with food. These can lead to bleeding and ulcers. There are nerve medicines like gabapentin that can be used. They help with nerve level pain. There are muscle relaxants that can be used. There are also mild forms of narcotics that can be used. So we're trying a combination of these things, but ultimately, as long as the patient understands what to expect, that's really going to be helpful. And so if you look at that pain scale of 0 to 10, we don't want you to be at a 10, but we don't expect you'll be at a 0. And realistically, most patients, if they're in a 2 to 4 range on that pain scale, it's probably acceptable. And so we should really be limiting using narcotics both in the hospital and after to, when you get to 8, 9, or 10. And different people have different thresholds. So the medicines that are really problematic are morphine, fentanyl, Demerol, codeine, Norco, Vicodin, oxycodone. Those type of medicines, if you're being prescribed them by your doctor, it doesn't mean you have to take them just because you have them. And in addition, if you're not going to use them or you're done with them, you really should take them to a pharmacy or a drop-off place where they can be destroyed. There's a lot of damage that can happen if you leave your narcotics in your medicine cabinet and perhaps one of your children or your children's friends come over and use your bathroom and find that bottle in there and become addicted to narcotics simply because you didn't get rid of them. And so we need to be using less narcotics. They cause problems after surgery. They can lead you to be in the hospital longer. They can cause addiction. They can cause mental status changes. And so we try to limit the use. We don't want you to be in pain. We do need to have clear expectations of what it's going to be like after surgery. You will have some pain. You will get through it. It typically improves. But we all need to work together to kind of fight this crisis. We are seeing people die and really suffer because of the use of narcotics. Hope this has been helpful.